The U.S. Preventive Services Task Force has recently updated its cancer screening guidelines for women over the age of 40, but the guidelines are creating a lot of controversy and debate within the medical community.
Now, our 9 News health expert, Dr. Powell Coley, joins us this morning to break these guidelines down. Dr. Coley, thank you for being with us. We appreciate it.
Good morning, guys. Happy Friday.
Good morning. Happy Friday.
How have we seen these guidelines change over time?
You know, it's been really fascinating. When to start screening women and how often to screen them has been such a topic of debate. So the U.S. Preventive Services Task Force used to say, let's start screening at 40. Then they flipped to 50. Now they flipped back to 40, and they're saying every 2 years as opposed to doing it every year. Now, this is in contrast to what the American Cancer Society says, which says you can start at 40 and you should do it every year. So you can imagine it's creating a lot of confusion amongst people as to when should they start getting their mammograms.
What would you say is the biggest criticism and the biggest worry about the change?
Well, I would say a couple of things. So first, they're saying every 2 years, not every year. Now, if you think about breast cancer, which is the second leading cause of cancer death in women, you can get a small cancer called a ductal carcinoma in situ, which you don't feel a lump on. The only way to diagnose that cancer is through a mammogram, and it's curable. But if you wait 2 years between mammograms, you can imagine a small cancer could turn into a bigger one. You could potentially be missing some of those early cancers. The other piece of this is that they don't talk about dense breasts. And we know that about half of women over the age of 40 have dense breasts. And so if a mammogram looks at a dense breast, it sees white on white. It can't pick up a cancer. So some of those women might actually need a MRI in order to diagnose their disease.
What are doctors warning their patients about because of this criticism? Do they say, kind of anything differently, maybe more frequently?
Yeah, I mean, what they're saying is that every woman needs an individualized assessment. Personally, I feel like we should start at 40 and we should do it once a year because the risks of doing too many mammograms, in my mind, are not quite as bad as the risks of missing an early onset cancer. So what are the risks of doing too many mammograms? Well, one is overdiagnosis, false positives, right? You end up having procedures that you don't need, or you pick up something that turns out to be benign. The second, radiation, right? A mammogram gives you a little bit of radiation. How much radiation? About the same as 7 weeks of background. So in my mind, that's not a lot of radiation, but you can imagine over the course of a woman's life, that can start to build up. And then cost. Because this is a preventive service. If every woman is going to be getting it, is it going to create too much of a population cost? And what's important is the guidelines determine the insurance coverage.
Yeah. Right.
So if you don't have the guidelines that are in alignment, insurance companies can decide to cover, not cover, and it really does make it difficult to know what to do.
So right now, when you're talking about those costs, insurance is saying, well, we'll pay for this every other year.
Exactly. So if you're a woman who wants to get it every year, you're sort of up the creek without a paddle. You might have to cover it yourself.
What about patients who are transgender or non-binary? How does this apply for these patients?
Yeah, so they said if you're born female at birth, these guidelines apply to you. So if you're cisgender, transgender, or non-binary, you still have to follow these types of guidelines. And to me, that's a big advance as well, is trying to develop guidelines for this particular population. Because in the past, we don't really know what to do with people who end up becoming transgender and then get exposed to different hormones.
Yeah, for anybody who's just kind of worried, maybe they're afraid that they might miss something on their own, what do you say to them?
I say you definitely need to talk to your doctor, and these guidelines apply to sort of average risk women. So if you're somebody who's had breast cancer, has a family history of breast cancer, BRCA carrier, or you've had radiation to your chest, these guidelines don't apply to you. Probably need to start significantly earlier.
And really quickly, I want to add, to just add to that question. If you're, let's say, 20s or 30s, you're under the age of 40.
Yes, and so if you've had breast lesions, even in your 20s, you potentially could qualify for cancer screening because when we're in our 20s and 30s, we're in hyperhormonal state.
Right.
So our breasts are really active, the tissue's turning over, we can get a lot of lumps and bumps in our breast. If any of those turn out to be high risk, your doctor may recommend earlier screening. If you've had a family history, you may need to start 10 years before your first degree family member.
All right, well, thank you for breaking that down. It's such valuable information. We appreciate it.
Absolutely. And you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.